are people here from 34 states in this country. They're all medical cannabis patients that are fighting for safe access. I think something that people don't understand about our movement and about the work that these people do, it's going to be on film later. But the work that these activists do is mostly sitting in city council rooms, sitting with regulators, learning of how to make their medicine available safely in their communities. Their mothers, their grandmothers, their sisters, their brothers. And we are not trying to bring something to the United States that isn't already here. We're just asking that our experience for our health is recognized by our government. And for too long, the federal government is just allowing this conversation to happen at the city level. And the reality is that there are 1 million legal medical marijuana patients in this country, and our federal government has no space to talk about our issues. And so I am very honored to introduce one of our champions here in Congress that is bringing our voice and bringing solutions for safe access. Representative Blumenauer from Oregon, thank you so much.
Yeah.
Thank you for being here, for putting a human face on an issue that too long has been insulated from thoughtful discussion at the federal level. There has been a revolution, you may have noticed, in terms of what's happened with alcohol, with prohibition. You know, things started changing. Well, over the course of the last 40 years, there's been some adjustment as it relates to attitudes and policy regarding marijuana. But it's all been at the state and local level. The federal government has been frozen in time since 1970. Well, I think the most profound changes have taken place in the arena of medical marijuana. And it started in California, 1996, where voters decided that the federal policy that somehow marijuana was Schedule I with no therapeutic benefit was just flat out wrong. And since that time, with that leadership at the state level and at the District of Columbia, now 19 jurisdictions have decided that they're going to allow their citizens to have access to medical marijuana. 2/3 of those approvals took place with a vote of the people. But now we're finding this clash has reached proportions that just it's time for Congress to help sort out this mess. Because, as Steph mentioned, there are probably over 1 million people. We don't know exactly because of some of the quirks in the California law. But 1 million is a very conservative estimate of people who are legally, under their state law, having access to something that helps them. And you're going to hear from people who talk about the difference it makes for their conditions. And that's so important for people to understand how this can be transformative for patients. Well, President Obama this fall, in the aftermath of votes in Colorado and Washington State, said something about the federal government has bigger fish to fry than interfering at the state level. But there are people here who can tell you that there are still some people further down the federal food chain who are still frying those fish. And frankly, the people in the federal hierarchy are in an impossible position. Under federal statute, it's Schedule I. But as I mentioned, 19 jurisdictions have said it's legal and important. We want to sort that out. We've introduced legislation that would have the classification adjusted so that it is not something that the federal government will interfere with under the federal drug statutory scheme. And second, something that I think is just as important is it would open up the opportunity for legal research into the therapeutic properties. Yes. Right now, this is too much trial and error. Yes. Right now, the federal government, you can't legally get marijuana for research unless it's dealing with addictive properties. We think that's missing the boat, because there are clearly therapeutic aspects, and the more that we can have legitimate, thoughtful research underway, it makes it possible to be able to tailor the medicinal aspects to the needs of individual people with individual conditions. So I'm pleased that we're here. I think we're on the verge of having significant adjustment to this policy.
Yes.
Get the federal government and the Department of Justice out of this never never land.
Yes. Thank you.
But more important, have the federal government respect the decisions that have been made in states around the country and will continue to be made, and be a partner in terms of research, development, appropriate law enforcement, not harassment, and not sticking our head in the sand. We hope that you will look at the legislation, add your voice to it, and most important, just to those of you who are advocates, taking your personal stories to men and women on Capitol Hill who are members of the House and Senate, and even more important, the certified, smart, largely young people who run the place, for them to know your experience and your expectation. We look forward to working with you to having the legislation enacted and for you to get the protections and the assistance you deserve. Thank you very much.
Thank you. Okay. So one of the things that we learned about ourselves as a movement this weekend as we came together to Washington is that there are several stakeholders that make up this unified movement. And one of our newest members, but one of our strongest members of this coalition is United Food and Commercial Workers, who are representing the individual people that bring us our medicine. And so it's my great honor to introduce you all Dan Rush.
Yeah!
Hi, my name's Dan Rush. I'm the Director of the National Medical Cannabis and Hemp Division for the United Food and Commercial Workers International Union. And UFCW, we have found ourselves as the union where workers in this industry have gathered to come and find our voice, to come and find their voice. And UFCW is the retail, agriculture, food processing, and food packing healthcare industries union. And also with hemp, we are the textiles industries union. We are the natural place for workers in this industry to come. They work in our core industries. And we're proud to be here and proud to be a coalition partner and proud to be part of the unity and part of the dignity that we're going to find for this industry and our members and the workers in it. And we're proud to stand with our industry, our community partner, Americans for Safe Access. When it comes to medical cannabis, those that are the most vulnerable are patients and workers and communities. And we're glad and proud to be here and be part of that dignity and unity. Thank you. Thank you. Yeah.
And so there are a lot of victims in this war, and we talk a lot about the patients that are afraid of their access. We talk a lot about the individual providers that actually risk their freedom to bring us our medicine. But the reality of the work that happens at the state level is that we have amazing champions in our state legislatures that are thoughtfully figuring out how to bring our medicine to patients. And putting together bills to protect us is a lot of work. And the fact that our legislators actually put staff time and effort to being our champion at the state level is just amazing. And the federal fight comes down on them as well. And so I'm honored to introduce you to our champion in the state of Maryland, Delegate Glenn. Woo!
Yeah! Good morning, everyone. Good morning. It's an honor and a privilege to be here.
We are talking about medical marijuana, and I want to begin just by quoting something from our Declaration of Independence.
Woo. All right.
We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness.
Woo. Woo.
Yeah. That to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed.
Yes.
Okay? That whenever any form of government becomes destructive of these ends, it is the right of the people to alter or to abolish it and to institute new government, laying its foundation on such principles and organizing its powers in such form as to them shall seem most likely to affect their safety and happiness. And I'm saying that to say that it is the right of the people not to have to suffer. People need to be able to have medical marijuana in this great country.
Yeah.
We have had so many states have instituted well-constructed laws. We in Maryland are trying to do the same. It is incumbent upon our government, the United States of America, to provide for us, the people. And that's what we expect our government to do. Our government is elected for the people, by the people. And we trust that our elected representatives will remember their oath, and their oath is to serve the people. I am a public servant in the great state of Maryland right next door, and I will not rest until we pass a medical marijuana law in the state of Maryland. And further, I will do everything that I can in my power to make sure that we pass a federal law. I will be talking to our congressional representatives. I will be leveraging all the power of my position as a state delegate. I will be bringing with me the Legislative Black Caucus. We just elected the next national president from the state of Maryland, Kathy Pugh, Senator Kathy Pugh. She will be the next president of the National Legislative Black Caucus. So we will have the power of that organization behind us as well. So I will just end by saying that the fight goes on. We're going to continue every effort that we can to make sure that the people are protected. We don't let animals suffer, so why should we let people suffer? We're going to do this. Thank you so much. I'm in for the long fight.
Does anyone feel oppressed today? Thank you. The work that really goes behind passing these state laws is a combination of just amazing champions like Delegate Glenn, but also tireless advocates. And this election was important for our community because we added another medical marijuana state to our numbers, and that is the great state of Massachusetts. It's very exciting. But the work to get that passed meant that individuals had to take time out of their lives and spend days and days in front of the media talking to medical associations. So it's my honor to introduce Dr. Karen Mcasey. That confused me.
Hello, my name is Dr. Karen Mcasey. I'm a physician, I'm a mother, and I'm a breast cancer survivor. And in 2004, I was diagnosed with advanced breast cancer. At that time, I had to choose between breaking the law or suffering horribly. And I chose to suffer horribly, and it was an awful experience. And I've been working on this issue for a long time, and I just don't want anyone else to have to make the terrible choice that I had to make. So let's keep up the good work.
Thank you, Karen. And another advocate is here, who also worked on passing this law. He's a very brave man. He's the Iraq veteran, Scott Murphy, who's now with the Coalition for Responsible Patient Care. Scott? It's okay. It's a fun problem to have too many people to walk through, right?
Hello, my name is Scott Murphy. I'm a veteran from the Iraq War. I'm pushing issues for the veterans that are coming back with chronic pain and mostly PTSD. As you're all aware, we're losing 22 soldiers a day to suicide. If medical marijuana could help just one soldier with that, I think it's really a worthwhile cause for all of us to get behind and really push for it. I personally lost a close friend at the age of 22 years old after a second deployment. These are our young men that are killing themselves, and we just have to do everything that we can to end this. And if medical cannabis can help be the solution to that, I think we should do everything we can to try to push that really forward. Every day that we wait to push this, we can just keep adding up 22, 22, 22. You know, it may not stop every single one of them, but let's say it stops just two people. Let's stop 600 soldiers a year from killing themselves with medical marijuana.
Yeah. Thank you, Scott.
And our last speaker today is actually a patient advocate from Representative Blumenauer's great state of Oregon, who has been an inspiration to all of us. He was actually our patient award winner at our conference. And I think, as I said when I introduced him the other night, anytime I'm tired, I just call Jim and realize I haven't done enough that day. So, Jim,
He's behind you. He's coming right there. He's coming through. Come on, Jim.
you know what?
Your chair, Dad?
All right, this wheelchair's been active.
It's okay.
Let's go to him.
Go to Jim.
Rally around him.
Here he comes.
We know how to be patient.
I'm glad we're all here today. It's about time we got our U.S. government to listen to us. In Oregon, 14 years ago, our voters overwhelmingly supported our Oregon medical marijuana program. Yet the federal government still keeps coming in and interfering, arresting patients, arresting growers, and arresting distributors. It's got to end. Let's make it start ending today.
Thank you, Jim. So I just want to repeat that this is one of the proudest days of my life as a medical cannabis advocate, and all of you have made that possible. That when I live here in DC and I spend a lot of time talking to representatives in these offices, and for most of the people here until today, this has just been a headline in a newspaper, a political conversation that they could dismiss and leave. And you are bringing the face of our movement to these representatives. So I am confident that this year we are going to be the change that's going to make this happen. And we'll be back next year and every year that we have to. But we are making change happen today, and it's because of all of you. Thank you all so much. And you guys have